Welcome to the Bullitt County Health Department's Diabetic Defenders Workshop Series. We are so excited that you've chosen to join us. Diabetes health education is a very important topic here at the Bullitt County Health Department. In Kentucky, over 14% of the adult population is already diagnosed with diabetes. That's twice as high as the population amount in 2000. Kentucky currently ranks 13th in the nation for the adult population with diabetes. Because of these numbers, the Bullitt County Health Department has taken an initiative to help defend our diabetes population here in Bullitt County. We have created this workshop series to help build the skills that you need to take control of your health and take control of your diabetes care management. We want to welcome you to this recorded workshop series hosted here at the Bullitt County Health Department in November of 2024 for Diabetes Awareness Month. Please be sure to listen to all 4 series workshops as they were very helpful and equipped each and every resident that was able to attend with the skills that they needed to take control and become a diabetic defender. Enjoy the series.
Dr. Kreutzer. I have another slide that tells a little more about me, but our office is on Cedar Grove Road, so just that kind of next exit down. And these are 2 of my lovely staff members, Kelly and Lorraine. Yeah. And so, first of all, thank you guys for coming. I think diabetes is just one of the many things that obviously, we were going to talk about eyes today, and unfortunately a lot of it will be redundant because I'm sure you guys talked about it Tuesday too, about the condition, and you'll hear about it next week. But it's just a whole life thing, and so we're going to focus on obviously how it affects your eyes, but I cannot imagine, seriously, what you guys have to deal with on a daily basis trying to manage this. So good job for being here, and continue to try and reach out for help because it's definitely important. So, healthy eyes. I'm Dr. Kreutzer. This is a little bit about me. So I am from Shepherdsville. I graduated from Bullitt Central in 2000. And we were talking a little bit before, I kind of always had an interest in eye care. So I did finish with my bachelor's degree at U of L and went on to an optometry school at IU. Graduated from there and devoted an extra year to a residency, which not everybody outside of an optometry school has to do, but I wanted to do because I wanted to devote extra time to ocular disease, so diabetes being one of those things. And so honestly, afterwards, that's what I was telling them, I kind of wanted to work in more of a specialty kind of place, so like places that would maybe do cataract surgery and manage more kind of retinal diseases. And so I don't know if you remember, 2011 and 2012 was kind of like at the end of that recession, and nobody was hiring. And so it kind of just presented itself, this location over here on Cedar Grove in my hometown. It's kind of turned into a little health center, right? Mm-hmm. So there's like a big pediatrician's at one end, and they've got a U of L nurse practitioners, immediate care that's there now. There's a wellness center. What is it?
Is that PT place still?
Yeah, physical therapy's at one end, yep. They've got a pediatric dentist and a pediatric therapist where they work on like speech and OT and stuff on kiddos. So anyway, it's just been a perfect fit for us, and so we opened up there at the very end of 2012. And so this is my family over to the right. So that's my daughter who's 9, getting ready to turn 10 on Christmas Eve. And my son is 7, my husband Ryan, and then we have a big puppy named Nelson. Yeah, he is. He's adorable. So we do everything. So we are a complete eye care facility, in meaning that obviously, and that's actually one of the reasons I named us Healthy Eyes, is that's the most important thing we are going to do is make sure that your eyes are healthy, and if they're not, of course, talk about it. But we obviously can talk about glasses, contact lenses. If something is going on, we have medical care. We even have emergency care, so people call in, they have been working in the garage, have a piece of metal in their eye. Somebody all of a sudden has really cloudy vision and we need to get them in urgently and make sure they don't have like a retinal detachment. So a lot of crazy stuff. But we do a little bit of everything. We love kids, so we see kids of all ages. Believe it or not, the first time we recommend an eye exam is between 6 and 12 months old. And so that's just to kind of rule out all the big bad stuff. So it's really fun because I can go from an eye exam with a toddler and into the next room with an 80-year-old. And so it's really fun. Very different eye exams, but it keeps our day busy and we love it. So we are there to kind of help with anything. So to just kind of talk about the eye and why that's important for you guys today. The eye I kind of consider as the window to your overall health. So it's just physically a way that we can look inside to see blood vessels, and we can see nerves and all of these things without doing an x-ray or an ultrasound or cutting you open. So this is just kind of a diagram of the anatomy of the eye. So the very front part of your eye has a cornea, that's the clear covering that protects your eye. So light goes through the cornea and then through your pupil, which is just a hole in the iris, through the lens. So that lens is what gets cloudy over time. It's what we call a cataract. And then all the way to the back part of your eye. So all of that kind of like orange color is your retina. So that's the light sensitive tissue that lines the back part of your eye. Of course, back there we can see blood vessels. The optic nerve is the cord that connects the eye to the brain. So we can kind of see the front part of the nerve when we look inside the eye. And so what's really unfortunate is there's a ton of different things that can happen back here. And the really sad thing is that a lot of things can happen even before it affects our vision. So that's the preventative kind of measure of having an eye exam, even without diabetes, and making sure that everything's healthy. But then you add diabetes to it. So of course we'll talk a little bit about that specifically today. So this is just an example of a machine that we have. It's called an optomap or Optos. And so what you do is you look through this little hole, one eye at a time, and it literally takes a picture of the back part of your eye, all in just a split second. And so it's really awesome because it gives us that image to not only document and kind of compare over time, so it's kind of priceless for us instead of just like making notes of what we saw, but then for patient education, be able to show you what your retina looks like. Everybody's retinas are different and our anatomy of our blood vessels and optic nerve are different, and so it's really nice to have, and of course, pick up if anything's changing. So these are just some images. These are actually my pictures, so they're thankfully boring for now. But this is as if we were looking at me. This is the inside of my right eye, and that's my left eye. That's why they kind of look like mirror images of each other. So how the eye works is when light comes into your eye, the first place that should focus is right in the center. So that kind of darker area there. I guess, is the lighting okay? Can you see detail? Yeah. Okay.
I can turn
I was gonna say, can we dim it at all?
Yeah.
Just because, like, the next ones will definitely need the details. So I wonder. Yeah, perfect. Thank you.
Yeah.
So that darker area in the middle, like a bullseye, is called your macula. That's what controls our fine detailed vision. The brighter area, the kind of yellowish one, is the optic nerve. So that's what's sending everything back to the brain. Like I said, we're just seeing the front part of it. And of course, all those red lines are the blood vessels. So specifically, of course, we'll talk how diabetes affects those blood vessels and kind of what we see. But like I said, unfortunately, there's a lot of crazy stuff that can happen. So obviously the intro, insulin, and just diabetes in general. So diabetes is a disease, as you guys know, that causes your body to not be able to produce or properly process the insulin. Insulin is a hormone that's produced by your pancreas. Cool, weird little photo of what a pancreas looks like, I guess. And so the insulin is supposed to regulate the glucose in our body, or sugar, by helping the cells absorb that glucose out of the bloodstream, okay? So it's just trying to help regulate that sugar. So as you know, glucose comes from a lot of different things that we eat. I know these are a bunch of junky things, but I mean, pasta, potatoes, I mean, in addition to sodas and sweets and all the things that are so good and yummy. When the blood sugar levels are high in our blood vessels, it can obviously damage our entire body. So anything that blood is, or anything that's getting oxygen and nutrients from the blood vessels can be damaged by diabetes. So obviously the big ones, increased risk of stroke, heart attack, and damage to your kidneys, eyes, mouth, and nerves throughout your entire body. So like next week you'll hear about feet and all those things, right? So there's two main types. Type 1 is typically diagnosed when we're younger. It is because it's actually an autoimmune disorder. So something actually caused your body to attack your pancreas, and you literally aren't able to produce the insulin. And so that's why obviously usually kiddos are diagnosed. These are just a couple. So with the blood sugars being up in their body, it causes you to pee a ton. It makes them very thirsty because again, they're peeing a ton, very lethargic, have no energy, and tend to lose a lot of weight pretty quickly. So those kiddos aren't feeling really well and will go to the doctor hopefully and find out. So those patients that have type 1 diabetes have to have insulin to live. Alternatively, type 2 are the ones that are typically diagnosed later in life, but kind of like what you said earlier, unfortunately with the trend, even younger populations are being diagnosed because of obesity and just poor diet and health in general. And I don't know if this is true, but I found this. I guess today is World Diabetes Day, y'all. I know. I picked the right day. I don't know. Again, I don't know if that's true, but it was a picture I found, so I was like, I want to use it. As you know, these patients have to manage their blood sugars in different ways. Obviously, insulin is maybe one of them, but there are other ways with medicine and diet and exercise and whatnot that we'll cover. So this is just a little demonstration of that. So type 1 diabetes being on the left, so that's a very small percentage of diabetic patients are actually type 1. Most commonly, less than 40 years old, have to take insulin. Type 2 diabetes, which is the majority of diabetic patients, usually diagnosed later in life, and diet, exercise, medications, insulin, a lot of options. So, back to our eyeballs. So how does diabetes affect our eyes? The first one, and this is actually one that's very common before people even know they're a diabetic, is that it affects your focusing system. So it actually affects that lens. When we talked about the lens and like how that's where you eventually get a cataract, it affects how the lens focuses and actually throws people into being more nearsighted. So, I mean, we've got a lot of crazy stories. One was a patient called me over the weekend, and he said, he was younger, I want to say kind of mid to late 40s, and he said he's just, like for a couple weeks didn't feel real well, was using the bathroom a lot, really thirsty, and in the last couple days, all of a sudden, he couldn't see far away. He was like, I can't drive. I can't see road signs. And so, of course, I was like, I really think you should go to the immediate care or ER. And I want to say I think his blood sugars were like 700 or something stupid. It was bad. Yeah. So the good news is this part of it is transient. So it will fluctuate and even return back to normal once the blood sugars are regulated. So that's actually kind of a thing for us is if we have a newly diagnosed or newly treated diabetic patient, or just even better management than maybe it had been, we sometimes can't prescribe glasses or contacts or whatever because it's still changing. We're kind of chasing a moving target. So some of those patients, like this guy in particular, of course I had him come in, but we had to wait, like sometimes it takes 6-8 weeks for the vision to kind of plateau again. And then of course, once they get that under control and keep it there, it'll go back to their normal. And that's what sometimes they didn't even know what their normal was because it had been so long. So that's kind of one of the first and really early signs that not everybody, but a lot of people can have affect their eyes.
What's nearsighted? Is that where you can see here? Or?
Right, yes. I don't like the words, but yes. So technically
like
nearsighted means you see better up close than you do far away.
Okay, so like me, I see better far away.
Than you do up close,
Yeah.
right? So you're probably farsighted.
Yeah.
Mm-hmm. Yep. The other kind of really crazy story, so as a kind of, like I said, established patient, he was older, not diabetic, but he had been real sick. Do you guys remember? And like, I think it was COVID, wasn't it? And he said he didn't eat. Like he was just, you know how it hit some people so hard? He didn't eat for like 2 weeks. Like he was just so sick. And so his vision changed. And so he came in, and I mean, I believed him. Actually, so what happened is he was farsighted in his glasses. And he's telling us, I don't need my glasses, I can see without them. Like he was like, it's a miracle. And so I was like, I don't know, everything else looked healthy. I was like, I really think it's gonna go back now that you're feeling better, now that you're eating. And so he called us like a couple weeks later and he was like, you're right, I still need my glasses.
That's really
Isn't that weird? Yeah. So anyway, just my hunch was that it was the blood sugars. So obviously the more, I guess, permanent one and one that we really worry about. It's called diabetic retinopathy, so I know you guys have probably heard about that. This is a risk the longer we have diabetes, and obviously the less controlled it is. So even if you have really, really great control of diabetes, the longer you have it, so I'm talking like 20, 30, 40 years, if we are blessed to live that long, the risk of diabetic retinopathy is still there. So that's just another reason to try to keep doing what you're doing. So we'll talk a little bit about how it affects the blood vessels in the back part of our eye, and yes, unfortunately, it can be permanent, so that's why we take it so seriously. So what happens is the blood sugar, and this is throughout your entire body, okay, but the blood sugar in the blood vessels damages the wall of the vessel. So now blood and fluid leak out of the vessel instead of staying in it, and so that's the problem, is because the blood that's carrying all the nutrients and oxygen to our organs isn't getting to the organs. So that's why we have organ issues with diabetes. That's why we have nerve damage and issues with our lower extremities. Bless you.
Sorry, I can't stop looking.
No, you're right. And then obviously that's why it's so important when we look in the back part of your eye. And that's why your primary care and endocrinologists are asking if you've had your annual eye exams, because they know if we're seeing this, then that's a sign that at least we need to get either better control or make sure we're keeping the control that we have.
Is that picture showing a bleed?
Right, yeah.
Those little spots?
So the blood vessels, you see the lines are there, but all those blotchy areas of red are blood that's leaked out of the blood vessels in the retinal tissue.
Once it does that, will it like reabsorb like a bruise?
Right.
Or is it there forever?
No, it can reabsorb if the blood vessel heals.
Right.
Kind of like a bruise does, yeah. So the red is active bleeding. The whitish areas, you see the kind of like cloudy areas scattered around, that's actually where blood was, and the blood has absorbed, and it's left behind lipid. So lipid is like a fatty kind of color. So yes, that's pretty severe diabetic retinopathy.
Is that what they call, your kidney, like a fatty kidney? Or is that
Similar.
caused from something like that?
I don't know if it's the same cause. I don't know.
Okay.
I don't know that answer. Yeah, but probably, because so the blood and lipids, both those components are in our blood vessels and not supposed to leak out. Yeah. So, like I said, when we see something like this, and hopefully you guys will never see something like that, but we have to talk about it. So these next ones, this is kind of obviously more severe. So let me try to explain this. This is a tough one. So when we talked about oxygen, so our entire body and all of our organs need oxygen. And the oxygen is coursing through our blood vessels all the time. So if the blood vessels aren't functioning right and they're leaking blood and whatever, what happens is the retina now is starved for oxygen. And so when it's starved for oxygen, our brain thinks it can help, and it's going to actually send these abnormal blood vessels, because it's like trying to help. It's like, I'm going to give you some oxygen that you're missing. And they're really like squirrely, fine little blood vessels. They're really hard to tell in these pictures. The problem with those blood vessels is they leak like crazy. So they cause a ton of bleeding. So this is very severe. This is going to need treatment. This is bad.
Are these pictures made from that machine you showed earlier?
These
look into?
similar, yeah, like a similar picture, yeah. So like cameras, they can take them, yeah. Isn't that wild? So we don't want to get there. The other ones, remember we talked about the lipids, so those white little dots there is signs that there's actually swelling. And so do you remember that darker area in the middle is our macula? Our macula, like you've heard of macular degeneration. Our macula is what controls reading, seeing people's faces, seeing road signs. I mean, it's a very functional, we use it all day, every day. So when you have swelling that close or in the macula, that can be very visually threatening.
Is that the same as wet macula?
No, different, but just as bad. Yeah, I know, but different reason, yeah. This is from diabetes. Like you have this without macular degeneration, yeah. So this is really cool. So this is a machine that we also have at our office, and they have at a lot of eye specialist offices. What it's done is it's taken a cross-section of the retina. So these are literally the layers of the retina. So like the outside is the back part of the eye, and up there is the top of the inside of the eye, so like light's coming down, okay? So these are the layers of kind of a normal macula, we'll call it. So there's these bright white bands at the bottom, a bunch of gray layers in the middle, and the top one's supposed to dip, just like that. So this is kind of, like I said, a normal / average macula. This is one that has macular edema, so it's like a big mountain. And so you see, these are like the topographical maps where the mountains are red and the valleys are blue, and so they have a mountain.
So does that mean
Of fluid.
it's swelling, and that's
All
why
fluid,
pushed
all
up?
swelling.
Oh my goodness.
So they are not doing well at all, this person. So again, we'll get to treatments here in a minute, because thankfully there are some really good treatments. But first, obviously, I mean, we'd love to catch this. So I try to talk about it like if we're in a game, right? And we're losing a game. When can we start trying to win? Like, so if we're early on, it's a whole lot easier to try to win that game. Whereas if you're at the end, it's a lot harder. So in the beginning, obviously prevention. So diet, exercise, having regular eye exams. So that way if we start to see even the smallest little things, we can kind of talk about it. And it's not to like scare people. It's just to say, hey, we're seeing these changes and this is another reason to do better. And of course, that's not all on us or you. That involves your primary care and your endo and full scope. But we can at least be one little help there. So obviously, if prevention isn't enough and we get to that point, oh, this is really cool. So this is actually a patient of ours that we saw. It's really hard in here to tell, but the picture on the left is where they had, I'd say, mild to moderate. You see like a lot of the little hemorrhages and then a couple little white little blotches. And so their A1C was 10.9 at this picture. And they came back 2 years later. Well, we saw them in between, but 2 years later, now they're down to 5.7. You see how the blood's gone for the most part.
Oh
A
my
couple
goodness,
little
they got
guys.
their A1C down to
Right.
5.7.
Yeah, isn't that amazing? I know. That was before, this is before all the new stuff too. This has been a few years ago. But it's just to say, like, it does work. It's just to be encouraging to say it helps. So if that's not working and if it progresses to those other advanced forms that we talked about where it causes a lot of bleeding in the back of the eye, what they can do is a laser procedure. And again, you don't want to be here, but it's a treatment that can help. So remember how we talked about how those blood vessels are growing because the brain's trying to help, because the retina is starved for oxygen? What the lasers do is it literally damages the retina to kill it, so it stops sending the mechanism that it needs more oxygen. So it's sad, but it's just how so it's just like a bunch of little spot welds all around the retina. And they will lose some of their peripheral vision from this, but it's to prevent total vision loss. So this is done actually in the office, not by a retinal specialist. Thankfully there are other treatments now, but this one is still done if kind of necessary. So the next one is more common. So have you guys heard about the injections? Do you know anybody? Okay, so I know it sounds scary, but thankfully, if there's too much bleeding in the back part of the eye that does need treatment, there are actually injections. And so it is a needle in the eye. It's a medication that they put inside the eye, and it's helping to shrink those abnormal blood vessels by just being, it's a medication that does it. It's actually a cancer medication. I don't know, forever ago, probably more than that, 25, I don't know, whatever years ago. It was a colon cancer, I think, medicine. And some really smart ophthalmologist noticed that and I'm sure he was at like a specialty center or something, but he noticed that his patients that were on this cancer medicine, their diabetic retinopathy was getting better.
Mm.
And so he started actually injecting it like off label. And anyway, now it's like kind of a mainstream thing. So it's actually kind of cool that he put two and two together. But all that to say, I know it sounds scary, it actually is really effective. It works really well, it works really fast. The problem is that it's short term, so people have to go back like every 6 or 8 weeks and have it repeated to keep it that way.
And there's no side effects?
Yes. Most commonly, no. I mean, it doesn't feel great. But they numb you, you know. So like people say that it's like achy, and they have these weird floaters for a couple days. But anytime you're talking about injecting something, there's always risks of like infection and stuff. So
it's infection, mainly it's not.
right, right,
Over 30 years.
right. Yeah, it's mainly like the kind of anything that getting closer and going in your eye kind of stuff. Yeah. But they do a ton of them. So this same kind of medicine is used in macular degeneration patients. So that's why I say they're pretty practiced at it, which is sad, but hey, it's there.
So does that dissolve the small blood vessels, or is
Kind of, yeah. It's kind of killing them.
Okay.
Yeah.
But not to the degree of killing the retina like
Right.
the previous.
It's trying to only kill the blood vessels. Right. It's trying to help with that inflammatory pathway. Yeah. So yes, it's a much less invasive in a way.
Right.
I mean, laser is at least permanent, whereas this you have to have done every 6 weeks. So it's.
But the risk of like long-term loss of peripheral vision as compared to the laser, is that not as much of a risk with these injections?
I wouldn't say so. I would say it would be better. Yeah. Unless you had a complication, right? But. Yep. Oh, this is that same picture. Remember the mountain? And that was after 2 injections. Look how flat it is.
Wow, my goodness.
So that's why I say it works. It's just still not ideal. But so we're kind of concluding here, but and of course I'll answer any questions you have. I kind of go back to, right, like, because we don't want to have lasers done, we don't want to have injections done, so ideally we're going to try to prevent to even get to that point. So seriously, just an overall health mentality, right? So managing blood pressure, cholesterol, blood sugar, so all the things. If we can help the blood flow in any way, so yeah, blood sugars is one of them that we're talking about today, but any way we can help that will help in the long run. I talk a lot about nutrition, and I know this is kind of funny, but for real, a lot of the green leafy vegetables are very high in antioxidants that are healthy for our retina. So spinach and kale, eat it a couple times a week if you like it. Fish, that's why you hear about fish oil. Fish oils are really good for our retina and our, just even the surface of our eyes. Staying hydrated, you know, just like I said, general stuff, but UV protection, so having UV protection whenever you're outdoors can help also protect your retina from all just the other elements. Or glasses, your glasses will have UV protection too. You know, wearing a hat. Don't smoke. Is anybody smokers? Okay, good. No, good. I don't have to get on any of you. I'm like, if you need one more person that's going to get on you, it's us. And it's just known to help promote issues with our retina. And then, of course, having your eyes checked regularly. So again, I know that's why we're here, but for real, that way if anything is changing, we catch it and we can kind of talk about it.
Did you see that they're gonna make everybody have eye exams before they
Yes.
get their driver's
Yeah,
license?
I can talk to, yeah, I'll do that in a minute. I'll talk to you guys about that, because it's actually not going to be as bad as you think.
Oh, wow.
Or, I mean, it'll be good, but like even for you all, it won't even be that big of a deal. Yeah. And then I always end with a comment. And I kind of figured it'd be mostly women tonight. So I picked that one. But, so the way the driver's test will go, so when you're up for renewal of your driver's license, within that 12 months of that, you'll have to have either, like you'll get your screening when you go in, or if you've had an eye exam, your eye care provider can fill out a form. So if you're having your eyes checked regularly, it doesn't even affect you, except that you'll need to do that form.
Yeah.
It actually affects us, because we'll have to fill out the form. So we have to talk about it as a staff, like, hey, we're gonna start seeing that. If you haven't had an eye exam and you don't have that form filled out, you'll sit like we did when we were 16 and look at that little thing and they'll check our vision. And then if you fail it, like their fail markers are actually a little bit more conservative even than the legal, because they don't want to get too close. So I think it's like 20/40. So if you don't see 20/40 or better in either eye, they'll request an eye exam, and so they'll have to come see us. But you won't believe how many people come in to see us and we're like, you really should not be driving. So it'll be a good thing, but just so you guys know, if you're having your regular eye exams, you'll be good anyway.
Yeah, I wondered why that was removed from the driver's license. Because
Oh, for
back in
you?
my day, we had to, here in Kentucky, we had, when you got your license.
When you get your license, you
And
do.
if you needed
Yeah.
correction, it actually said it on your license.
It will,
So that if you get pulled over or something, they'll
Yep.
offer your license.
and that's what the new ones will. So if
I always wondered why they
If the
stopped
form
doing
we do fill out, or if they go and like they sit at that screener and they're wearing glasses, like if they have to wear their glasses to pass the screener, it'll say restricted. Which.
How will they be able to tell if they need them at night? Cause I have a friend who can drive great in the daylight, but at night.
It'll probably say restricted. I know. I don't, at least as far as I know, I don't think there's like a day to night.
Thank you so much for watching this episode of the Diabetic Defenders, Building Your Defense Against Diabetes. We hope you'll join us for the rest of the series as well. Click subscribe on the Facebook page or Instagram and YouTube, as well as Twitter. We look forward to seeing you next time. Bye.